Defibrillation is a life-saving procedure that is used only in patients in cardiac arrest. It is indicated for the treatment of pulseless ventricular tachycardia and ventricular fibrillation, commonly referred to as VFib. The electrocardiographic tracing of VFib consists of randomly occurring chaotic activity with no discernible depolarization or repolarization waveforms. Note that VFib may be of the coarse variety, as shown here, or it may be fine with a lower amplitude. Ventricular tachycardia appears as wide, complex tachycardia on the EKG tracing. If the patient in ventricular tachycardia is pulseless, then the treatment is the same as for VFib. If the patient has a pulse, then cardioversion rather than defibrillation is indicated. Electrical cardioversion is discussed in a separate chapter. Defibrillation should not be attempted in patients who are in asystole, since defibrillation may actually worsen the prognosis in these patients, who already have a negligible chance for meaningful recovery. Given the extreme urgency for rapid defibrillation, there is no time for patient preparation other than initiating basic life support maneuvers and attaching the defibrillator to the patient. Upon confirming the presence of pulselessness, instruct additional caregivers to open the airway, perform bag valve mask ventilations, and begin CPR. CPR should continue without interruption during the resuscitation, pausing only long enough to safely deliver countershocks. Attach the defibrillation pads in the anterior lateral position. Place the lateral pad in the left mid-axillary line at the 4th or 5th intercostal space. Place the anterior pad to the right of the sternal margin at the 2nd or 3rd intercostal space. Attach the cable from the defibrillation pads to the monitor cable. Turn the monitor on and confirm that the rhythm is ventricular fibrillation or pulseless ventricular tachycardia. Once the monitor has been connected to the patient and turned on, select the appropriate energy level for the first countershock. Push the Energy Select button on the monitor until the correct energy level is displayed on the screen. Appropriate settings will vary depending on whether a monophasic or biphasic defibrillator is used. For the device depicted in this video, which incorporates a biphasic rectilinear waveform, 200 joules is used for the initial and all subsequent countershocks. Refer to the written supplement for recommended energy settings for other types of defibrillators. Before charging the machine, it is essential to assure that no caregivers are in direct contact with the patient to avoid being shocked themselves. Firmly announce, "Charging defibrillator, everybody clear." Once everyone has stepped back from the patient, press the charge button, and the defibrillator will charge to the selected energy. Once fully charged, confirm that you are not in contact with the patient and firmly announce, "I'm clear." Check that the other members of the resuscitation team are not touching the patient or stretcher, and announce, "Everyone is clear." Then depress the shock button. Immediately resume CPR after the countershock and continue for 2 minutes before reanalyzing the rhythm. Continuous CPR with minimal disruptions is essential. Interruptions should occur only for pulse checks, rhythm checks, and defibrillation. If the rhythm remains ventricular fibrillation or pulseless ventricular tachycardia, prepare to shock the patient again. First, select the appropriate energy level, then clear the patient and charge the defibrillator. Recheck to make sure that everyone is clear, and finally, depress the shock button. Resume CPR for 2 minutes before rechecking the rhythm. If the patient reverts to sinus or another perfusing rhythm, check for a pulse. Further treatment should then be provided according to the ACLS algorithms. If the patient remains in ventricular fibrillation or pulseless ventricular tachycardia, further countershocks are indicated. Self-adhesive defibrillation pads are preferable for delivering countershocks, but if they are not available, the defibrillation paddles may be used instead. First, apply electrode gel and distribute it evenly along the surface of the paddles. Place the anterior paddle to the right of the sternal border in the second or third intercostal space, and the lateral paddle in the left mid-axillary region at the fourth or fifth intercostal space. Press down with about 25 pounds of pressure to ensure adequate contact between the paddles and the chest wall. To defibrillate, follow the same sequence as described in the previous section. Note that Energy Select, Charge, and Defibrillate buttons may be found on the paddles, or an assistant can push the buttons on the front panel of the machine. To defibrillate, push the shock buttons on both paddles simultaneously.